On tonight's Hot Topic Tuesday, November is Lung Cancer Awareness Month, and according to the CDC, lung cancer is the leading cause of cancer deaths for both men and women in the U.S. Joining us now is Dr. Troy Moritz, a thoracic surgeon with UPMC. Thanks for being here tonight. So first, what are we seeing when it comes to lung cancer rates in the U.S.?
Yeah, so lung cancer rates in the U.S. are declining as we'd expect as smoking populations decline. But they're not declining as much as you would expect given the drop-off in smoking.
And then what are the traditional risk factors when it comes to smoking?
Yeah, most of the time smoking is the main risk factor. Secondhand smoke, radon levels in your house, asbestos, diesel exhaust, those are all thought to be minor players, but risk factors nonetheless.
And are we seeing lung cancer happening in people who don't really have a history of smoking? We're seeing it more?
Now that people aren't smoking as much, we do see more smoking more lung cancer in people that don't smoke. That it was when I first started 15 years ago, we thought of it maybe 5 to 10%. Now it's more like 15 to 20% of the population of lung cancer people that don't actually smoke.
And so what are some of the warning signs? What should we look out for?
Yeah, lung cancer has always been thought of as sort of the silent killer, if you will. But some of the signs that we do see that people may exhibit are a chronic cough that maybe doesn't go away after a cold, somebody that maybe is getting more and more short of breath, maybe some fatigue, maybe unexpected weight loss. They're kind of vague symptoms, but those are some symptoms you want to talk to your doctor about.
Yeah, and then what's the best way to detect lung cancer?
Right now, the best method is lung cancer screening. It's a low-dose CAT scan. It's very quick and easy to do. You don't need contrast. And anybody that's 50 to 80 that's smoked about 20 pack years worth of cigarettes is eligible for lung cancer screening, and if you haven't quit within the last 15 years.
And it's really low dose. It's nothing to be concerned about.
It's a lower dose than a traditional CAT scan, yes. Are
there new treatment options now for lung cancer over the years that have come out?
Yeah, in the last 5 years, I always tell patients, it's been like a renaissance for lung cancer. There's been lots of new medications that have come out. There's, in the last 5 years, probably more than there was in the last 50 years combined. There's lots of new targeted therapies. We have immunotherapy combinations that we use now. Surgical techniques have gotten better. Radiation has gotten more precise. So treatment has really gotten a lot better.
Yeah, it's probably in the quality of life as people go through lung cancer treatment. All right. Thank you so much for joining us, Dr. Moritz.
Glad to be here. Thank you.
All right.